Hi, my name is Hillary Boning, and today I will be presenting on my capstone project for my bachelor's degree. The topic is effects of proper education on the initiation of the human papillomavirus vaccine. I'm very passionate about vaccines in general, but I'm very passionate about the HPV vaccine. I think it gets overlooked and declined a lot, and it shouldn't. I think it's just as important as any other vaccine that you would receive. With that being said, I will jump into my presentation. We will go ahead and cover some statistics, some research studies, and my research study that I designed to improve HPV education. Some statistics: the human papillomavirus infects many people each year. In fact, the Centers for Disease Control and Prevention states about 79 million Americans are currently infected with HPV. HPV is a sexually transmitted infection. Although many of these infections can resolve on their own without any symptoms, some types of HPV can lead to cancers affecting the cervix, penis, anus, throat, and other types can lead to genital warts. The CDC recommends getting vaccinated against HPV to prevent these infections and protects against any types of HPV that can cause cancer. There are 7 types of HPV that can cause cervical cancer. These 7 types are responsible for 90% of all cervical cancer. HPV infections are also responsible for causing genital warts. The types of HPV that cause cancer are different from the types that cause genital warts. Sexually transmitted diseases like HPV can also be very costly. The CDC estimates $16 billion are spent each year to put towards medical costs in the treatment of sexually transmitted diseases. My PICO question. The HPV vaccine was developed as a preventative against the virus. This is a vital vaccination parents and guardians are choosing not to give to their children. The problem is poor HPV vaccine rates in children and adolescent males and females due to uneducated guardians. The intervention is early education about the HPV vaccine. The comparison is guardians whom have been educated regarding the HPV vaccine versus guardians with no prior knowledge of the vaccine. The outcome is to increase HPV vaccine rates in children and adolescents within 1 year. And here are some studies that were done. The Scottish Cervical Screening Program study, it took place from 2009 to 2013. It was conducted on women aged 20 to 21 years old. It had 5,765 participants that had cervical screenings. Most of the women from the 2009 and 2010 screenings were not vaccinated against HPV. In 2011, 38% received all 3 doses. In 2012, 67% received all 3 doses. And in 2013, 72% of women received all 3 doses of the HPV vaccine. Overall, women that tested positive for HPV 16 and 18, the most common cancerous types, vaccinated women were 11% positive for HPV compared to unvaccinated women that were 29.4% positive for HPV. Another study that was conducted in Queensland, Australia, it took place between 2007 and 2011. It surveyed over 8,500 females aging 12 to 26 years old. The program targeted school-age girls 12 to 17, but also offered a catch-up program for women aged 18 to 26 years old in community clinic locations. For school-age girls, 70% of the participants received all 3 doses of the vaccine. For the community-based program, 33% of women received all 3 doses. 4 years after the injections, females from the same population were evaluated at their first cervical exam. Women which were diagnosed with high-risk cervical abnormalities that were vaccinated by all 3 doses of the HPV vaccine totaled 119 compared to women that were not vaccinated by the HPV vaccine that totaled 729 females. The last study It was conducted in England between October 2009 and December 2011. It included 198 females aging 12 to 15 years old. These females had no previous vaccination by an HPV vaccine. The females were chosen at random to receive either Cervarix or Gardasil vaccine, which are both HPV vaccines. Blood samples were taken from the females prior to vaccination at 2 months from the first vaccination and again at 7 months from the first vaccination. For both Cervarix and Gardasil, higher antibody titers against HPV 16 and 18 were obtained after all 3 doses of the vaccine. Also, both vaccines elicited higher antibody titers against HPV 16 than HPV 18. In this portion of my presentation, I will kind of describe the research study that I would want to conduct, the design, setting, and sample. It would be a quantitative design because it is beneficial because it will precisely measure end results through numerical figures. The method used in the research study will be through a survey. The results at the end of the study in 2017 will then be compared to the HPV vaccine rates in 2016 before the interventions were put in place. The research study will be conducted over a span of 1 year in a pediatric clinic setting. The research study will be conducted through a survey. There will be 200 to 300 participants in the sample. All children and adolescents aged 11 to 18 years of age will meet inclusion criteria. At the beginning of 2017, a letter will go out to all parents and guardians of children and adolescents aged 11 to 18 years of age with information about the HPV vaccination. This information will contain statistical information provided by credible sources such as statistics from the CDC on how the HPV vaccine can prevent cancers and genital warts in males and females. Also, the nurses at the pediatric clinic will be responsible for educating guardians and parents about the HPV vaccine at each visit. The HPV vaccine will then be offered to parents and guardians with children and adolescents aged 11 to 18 years of age. Informed consent will be obtained from the adolescent's parents or guardians. Consents will be handed out with the child or adolescent when they come to the office. There will be information about the research study along with the consent for the parent or guardian to sign. These consents will be given out with other privacy forms and must be completed prior to the child's care. Only those who have informed consent will be allowed to participate in the study. It will be the clerical staff's responsibility to give out the information about the study, but it will be the nurse's responsibility to educate those who decide to participate in the study and collect the consent. Also, the study will not use any patient identifiers that could potentially lead to a breach in their privacy. To collect data for the research study, a survey will be given to all consenting guardians at the end of their child's visit by the nurse. The survey will demonstrate if early and repeated education about the HPV vaccine improved the 2017 HPV vaccine rates compared to the rates in 2016. A survey is a useful and reliable tool when conducting data collection. A survey asks a standard set of questions about one's beliefs and opinions. Survey questions would include, for example, the guardian's opinion if any education given in or by the office persuaded their decision. This method will allow for a precise measurement of how effective the research study was. The researchers in the study would use independent sample t-tests to conduct data analysis. Independent sample t-tests compare the mean difference between 2 independent groups on a given variable. In relation to the research study, the 2 independent groups would be guardians whom have been educated regarding the HPV vaccine and guardians with no prior knowledge of the vaccine. The given variable will be if the vaccination rates improve after strict HPV education is put into place. The Centers for Disease Control and Prevention estimates about 14 million people become newly infected each year with HPV, and it is so common that most sexually active men and women will get it at least one type of HPV infection at some point in their lifetime. So in conclusion, educating these caregivers early and continuously will ensure proper knowledge and clear up misconceptions about the HPV vaccine. The research study has potential to improve patient outcomes by protecting children and adolescents from potentially developing cancer. It is important to protect them so disease is not spread and quality life is not damaged. That concludes my presentation, and thank you for listening.